Welcome to Lesson 2.2, Climate Change and the One Health Approach. In this lesson of the Climate Change module, we establish the essential foundation for understanding why climate change is not only an environmental issue, but also a rapidly growing global health threat. This session is designed to provide a comprehensive overview of how climate stressors create cascading risks that simultaneously affect human populations, animals, and ecosystems, requiring integrated and collaborative solutions. We begin by exploring the climate health link, emphasizing that rising temperatures, droughts, flooding, and extreme weather events do not impact one sector alone. Instead, they disrupt ecological systems, alter disease dynamics, threaten food and water security, and increase vulnerability across entire communities. The lesson highlights why traditional siloed approaches, where human health, veterinary services, and environmental agencies work separately, are insufficient for managing climate-driven health crises. The first key concept introduces the One Health approach as a collaborative, multisectoral, and transdisciplinary framework. Learners examine its origins, evolution, and core principles, including interdisciplinary collaboration, ecosystem-based thinking, preventive focus, and equity-centered interventions. The lesson emphasizes that One Health aims to prevent health threats at their source by addressing shared risk factors across humans, animals, and the environment. The second key concept focuses on interconnected climate-driven health risks. Learners explore how warming expands vector habitats and transmission seasons, increasing the risk of diseases such as dengue, malaria, Lyme disease, and West Nile virus. The lesson also explains how habitat loss, deforestation, and climate-driven wildlife migration increase human-wildlife livestock contact, raising the likelihood of zoonotic spillover events. Additional climate health impacts discussed include heat-related illness, mental health burdens, food insecurity, and waterborne disease outbreaks caused by flooding and sanitation breakdown. The third key concept examines One Health in practice, emphasizing integrated surveillance, community-based interventions, and the use of digital technologies. Learners explore how combining environmental monitoring, animal disease data, and human health surveillance can reduce outbreak detection time from weeks to days. Real-world examples such as West Nile virus surveillance in Italy demonstrate how coordinated systems improve response time and provide major economic savings. The lesson also highlights WASH solutions, antimicrobial resistance monitoring systems, and climate-resilient health infrastructure as key One Health strategies. The final key concept addresses policy integration, workforce development, and future directions. Learners examine how national One Health action plans, whose strategies and SDG frameworks support coordinated climate adaptation. The lesson also highlights challenges such as funding gaps, fragmented data systems, and institutional silos, while emphasizing the future role of innovation, AI, and equity-centered policies. Upon completion of this lesson, participants will understand One Health as a critical framework for building resilient, equitable, and sustainable health systems under climate stress. This lesson provides a foundation for advanced learning in climate adaptation planning, outbreak prevention, sustainable agriculture, and global health resilience. Thank you for joining us.